Communicable disease corona. This is not a sound alarming at all, but coming days situation shall turn worse. WHO terming the novel corona pandemic. Coronavirus over 1,24,000 cases worldwide, more than 4,550 deaths from COVID-19. Corona cases touch 60 India. Asian stock market fell as the COVID-19 outbreak is growing every single day. The world economy is getting badly hit. Implements the Epidemic Disease Act of 1897 for the control of COVID-19. Corona disease spreads like plague, cholera and AIDS. Recently, swine flu throughout in India. Recently, many states in India have invoked various provisions of the Epidemic Diseases Act of 1897 to control communicable diseases. It has kept up with the recent global developments in disease surveillance, disease control, and rights perspective. This year, many states invoked various provisions of Epidemic Diseases Act of 1897 to force COVID-19 affected person to be segregated and get themselves treated at recognized isolation treatment facilities and notify cases of COVID-19. It is important to critically evaluate the Epidemic Diseases Act of 1897, its relevance in the current context and whether EDA 1897 deals with there is a need to strengthen legal frameworks to prevent and control the entry, spread and existence of communicable diseases in India. Emergence and re-emergence of communicable diseases in the country, especially in the changing public health context. The Epidemic Diseases Act was passed in 1897 with the aim of better preventing the spread of dangerous epidemic diseases. It evolved to tackle the epidemic of bubonic plague that broke out in the Bombay state at the time. The Governor General of Colonial India conferred special powers upon the local authorities to implement the measures necessary for the control of epidemics. The Epidemic Diseases Act is one of the shortest acts in India, comprising just 4 sections. The first section explains the title and the extent, while the second gives powers to the state and central governments to take special measures and formulate regulations that are to be observed by the people to contain the spread of disease. The third section describes penalties for violating the regulations in accordance with section 188 of the Indian Penal Code. The fourth deals with legal protection to the implementing officers acting under the Act. According to the provisions of Section 2 of the Act, which describes the powers of the government, when the state government is satisfied that the state or any part thereof is visited by or threatened with an outbreak of any dangerous epidemic disease, and if it thinks that the ordinary provisions of the law are insufficient for the purpose, then the state may take or require or empower any person to take some measures and by public notice prescribe such temporary regulations to be observed by the public. The state government may prescribe regulations for inspection of persons travelling by railway or otherwise, and the segregation in hospital, temporary accommodation or otherwise of persons suspected by the inspecting officer of being infected with any such disease. Section 2A empowers the central government to inspect any ship leaving or arriving at any port and for detection thereof or of any person intending to sail therein or arriving thereby. Section 3 states 6 months imprisonment or 1000 rupees fine or both could be charged out to the person who disobeys this act. However, these acts vary in quality and content. Most are just policing acts aimed at controlling epidemics and do not deal with coordinated and scientific responses to prevent and tackle outbreaks. There is a need for an integrated, comprehensive, actionable, and relevant legal provision for the control of outbreaks in India. They should be articulated in a rights-based, people-focused, and public health-oriented manner. Asian countries also participated action plan for control and prevent by policies overspreading of COVID-19 from Press Information of Bureau, Government of India, high-level group of ministries, review on current status and actions for prevention and management of COVID-19 by Harshavardhan, Union Minister of Health and Family Welfare. Indian government implement 11/3/2020 night order issues for controlling methods tourist visa cancelled for public celebrations. In India, Prime Minister not participated in holy celebrations. Bangladesh cancelled national celebration. Taj Mahal would close for public soon. And some danger looming over Tokyo Olympics too. Suggestions. Public participation is very needed for prevention and spreading COVID-19. Awareness is needed for personal hygiene and all countries should follow